Hi, and welcome to Chapter 21, Radiography and Surgery. In this unit, we're going to take a look at some of the things that you'll encounter when you're into the surgical suite. So one of the things that you need to keep in mind, there's going to be a lot of people, there's going to be very limited space, and we need to be aware of what we need to do to make our time more efficient while we're in that room. You do have some special surgical attire that you need to wear when you're in that room, so you need to dress accordingly for the procedure that's being done. So we typically have scrub clothes that we wear. You will have hospital scrubs that you put on, so you won't be wearing your Delta scrubs when you go into surgery. So they do need to be clean scrubs, so they're a non-sterile scrub shirt and pants, and then you'll have a mask to cover your nose and mouth, a hat, a hood that's going to cover your hair, and you'll have shoe covers that'll cover up your shoes. Socks must be worn with your shoes with closed heels and toes to protect your feet when you're moving around that equipment. And just remember, those objects can be pretty heavy, and even if you dropped an image receptor, you could break your toe, so that's the purpose of that. Gloves are down to handle anything that's contaminated with the patient's blood, and we do put on, we wipe our machine down and we put the plastic covers on our machines with the surg tech's assistance. So when you get into the surgical area, there's pretty limited people that can be in there. You need to have a reason to be in there. You're wearing your appropriate surgical attire. You've made sure that you've wiped down your equipment, and that if you need a sterile cover, you're going to place that before going over your patient. We do operate the C-arm and the portable when we're in the surgical suite, so it just depends on what procedure is being done and what the radiographer needs to do in that situation. So you'll know ahead of time what they've called for what piece of equipment. Some hospitals have image equipment reserved just for surgery, and some of your smaller facilities may have you bringing equipment up for surgery. It's nice to have permanent imaging equipment installed because then you don't have to worry so much about contamination. So we talked a little bit about the surgical clothing. Just know that you do need to wear your appropriate clothing. They don't want you to wear it outside of the hospital, so you'll grab your scrubs when you get there and then put those on. So this is pretty much what you're going to look like when you go into surgery. So you'll see you have the hospital blue. You're going to have your mask and your hat that you're putting on top of your head. If we need gloves, we'll put those on, and then we do have the booties on our feet covering our shoes. This is what the surgical room's going to look like when you come in. So again, watch for devices to make sure that you're not going to hit them when you're moving your equipment in or under the table. Some members are going to be classified as either being sterile or they're non-sterile. And so you have your surgeon, your assistant to the surgeon, some non-physician assistants. You may have a scrub person, which is your registered nurse, or your surg tech that will be floating around in the room along with your anesthesiologist. There'll be a circulating nurse or surg tech, again, that's kind of going around the room. And you could have some other techs. So there could be someone from the orthopedic company that is part of that procedure. So just be aware that there's quite a few people that are going to be in that surgery room. So you do have a sterile corridor, which is that area between the patient drape and the table. So only those wearing sterile attire should be in that area. So be aware of where your sterile field is. Make sure that nothing that you wear is going to dangle to contaminate that field. You want to make sure that you avoid putting anything in your pockets that may fall out. And then make sure that if you're passing behind the back of a sterile team, that you don't contaminate them. So when we're taking a look at what do, we are in surgical procedures involving radiography or fluoroscopy. So sometimes look at those T-tubes that we have been talking about for stones. We may be in there operating the machine. We use the C-arm a lot if they're doing fractures, especially for fracture reduction. So if they're putting in an alignment or hardware placements, we're going to operate the C-arms. Sometimes we get called in with the portable where we're going to look for foreign bodies. So maybe they've misplaced a sponge or a piece of surgical equipment, and so we're going to go in and take radiographs so that they can see what was left in the patient. Sometimes we do guide placements for special catheters or pacemakers in surgery. We're in for urological procedures, so stent placements. If they're having lithotripsy where they're removing the stone, we may be called in. So I do have a few videos with the C-arm that I want you to watch for the C-arm movements and how to drape your C-arm. I also want you to take a look at a piece of equipment called the O-arm. All of your facilities have the O-arm. Typically, the techs are specially trained on how to use the O-arm, so not everybody may be trained on the O-arm. Take advantage of going up and using that. So your O-arm, I have a video for you to watch on that as well, and that way you get an idea of what is this machine and why is it used. So take a look at those videos, and this is a very short chapter, but I think the videos do a little bit more justice of what do we do in surgery when you watch those. All right, have a great rest of your week.